Virus cases are on the rise among children in Michigan. Just last month, in October, over 7,000 cases were reported.
And right now, there are 18 children hospitalized across the state. Our chief health editor, Dr. Nandi, joining us now for this Friday afternoon. Doctor, and good afternoon to you. It appears the caseload has almost doubled since the summer.
Good afternoon, Glenda. Sadly, this is true, and as a parent, really concerns me. Now, back in August, right, the Department of Health and Human Services reported 3,600 pediatric cases, just over 3,600. But in October alone, this is important, they recorded over 7,100. That's a huge jump. And most of the kids that tested positive, roughly 79% of them, Dave and Glenda, were between the ages of 10 and 19. The rest were 9 and under. So that's concerning to me.
I would imagine some of that is because of in-person learning in schools. But what do we know about these 18 children that are hospitalized, Doc?
Yeah, we don't know very much because of privacy concerns, but we do know this, that 15 of them tested positive for the virus while the other 3 were suspected to be infected. So what we know overall is that we know that kids don't get seriously sick with COVID-19 as an overall statistic. Most have mild symptoms or no symptoms at all. But let me be clear, this is very important to emphasize. Children can and do get seriously sick, so we can't just blow that off. A few have sadly even died. Now, health officials say that the number is less than 5 right here in Michigan, but children can have long-lasting effects, meaning that their infection can be there, but they can have long-lasting health effects that last well beyond the acute infection.
So, Dr. Nandi, what about that multi-symptom inflammatory? Do we know if the children have been diagnosed with that syndrome?
So yes, Glenda, so multi-system inflammatory syndrome, or MIS-C for short, is a serious condition that appears to be linked to COVID-19. Now, here's what happens, right? As parts of the body, like the heart, the lungs, the kidneys, brain, GI organs, can get inflamed. Now, most children do get better with medical care, I have to emphasize that, but a few have unfortunately died. As for the kids recently hospitalized, again, due to privacy concerns, we don't have a lot of details, but we do know that so far 35 children in Michigan have been diagnosed with this MIS-C, and 20 of them were 9 or younger, and the rest were between 10 and 19. The overall message is this, right? That kids are getting infected. Now, yes, overall, kids don't get as sick as some of the adults that are at risk, but they can, and so we should watch this carefully. Again, the idea that if we can prevent everybody from getting this illness, and we know how to do that, that's the way to approach it.
All right. Thank you, Dr. Nandi. We appreciate it.
My pleasure.
If you have a coronavirus question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.